Hi everyone, welcome to Living Well with Dr. John, Adjustment Through the Lifespan. Today's topic is combating anxiety and depression associated with paralysis. Dr. John Chang is a clinical neuropsychologist and is board certified in rehabilitation psychology. In addition to having his own private practice, Dr. Chang is a professor of psychology at East Stroudsburg University and a consulting psychologist for both Lehigh Valley Health Network Pocono Medical Center and Good Shepherd Rehabilitation Hospital. Two quick notes before we start. You can turn on closed captions for the webinar at the bottom of your Zoom screens, and you can also ask Dr. John a question in the Q&A section, also located at the bottom of your screen. Now I'm going to turn it over to John. Hi, John.
Hey, Kaylee. Thank you for the great intro. I want to thank the foundation for giving me this opportunity once a month. I'm hoping that we come up with some great ideas for you. And I hope that you enjoy this hourly podcast. I also like to thank Angela. She is the conduit for me to be able to do this. So yeah, Angela and Kaylee, thank you. And Kaylee, thank you for helping me with this PowerPoints. I am John Chang. I am a clinical psychologist. I am also a 33-year-old post-injury C5 quadriplegic. My goal today is to talk about adjustment through lifespan, specifically focusing on combating anxiety and depression. And now there are a lot of other responses to having a spinal cord injury, like shock, denial, adjustment, anger, but I'm going to talk mostly about about anxiety and depression, only because those are the prominent two clinical concerns, main clinical concerns that we have. So next slide. I'm going to start off by reiterating a story that I talked about at the end of my last podcast. And each month I'm hoping to give you a story to think about. The story I talked about last month, that those who are on for the first time have not heard the story. What I was talking about last month was that there was a point in my life when I was in grad school that I wanted to make lunch for myself. I was very hungry. No one was home. And I was looking forward to having something to eat. Unfortunately, the only thing I could find was hot dogs that was on the top rack of the fridge. Now, I'm not going to give the whole story in detail because we don't have that much time, but basically, with my limitations and my paralysis in my hand, I ended up getting a hot dog, cooking it in the microwave, and then dropping it on my floor. I spent another 20 to 30 minutes of chasing this thing across my floor. And this 2-ounce, 3-ounce hot dog became about 5 ounces, mostly full of dust bunnies that I picked up as it rolled across my living room. The question I posed on the listeners over the last month was, would you eat this after all this time? Now, it took me over an hour to cook it, but it was full of a lot of junk. And the question is, would you eat that after all this? And my answer was, yes, I did. Of course I did. I did not want the hot dog to defeat me. And thus, I did eat the hot dog. It was the best tasting hot dog I ever had. So that's the answer to that story from last month. Next slide. So what am I going to do today? My objectives are, I'm going to briefly recover a little bit of last month's material, only because this is a 2-part series. Adjustment through the lifespan has the beginning, the basic things that you have to talk about, basic concepts when you have an injury. and the two parts that we're going to cover today, the coping methods and reactions. So the anxiety and depression are some of the results of how you cope. So those are some of the things we're going to talk about. We're going to talk about healthy coping. I'm going to teach you about a lot of unhealthy coping. And if you're able to identify those, and these are things you're doing, you are unhealthy coping, and you're not going to live well. To live well, you're going to have more healthy coping skills than not. Okay. I'm including my email if you wanted to try to email me some topics or ideas and suggestions. And I'm going to end this podcast with a Q&A at the end. Okay, next slide. Okay, so these 8 items on this slide are the concepts that I talked about last month or in August. These are specifically things you have to be aware of, no matter in general from all individuals, but when you have a spinal cord injury, you have to, or you will have to deal with these issues. What is your stress level like with your life because of your injury? How are you handling the loss and grief of not being able to move and walk? How do you see yourself and self? Your self-concept, how do you see yourself? Do you see yourself as a person with a disability? Or do you see yourself as the disabled person? What kind of stigma? How are you handling the pressure? People are looking at you. You know, people are judging you. It's impossible for people to judge you. If people say, I'm not looking at you, I'm not judging you, you know what? They are. You know, they are. It's just a natural reaction. Ultimately, what's your quality of life? Do you have a good quality of life? So we covered that last month. Okay. So with all that pressure and stress and areas of concern, how do you cope with it? How do you manage? What is the results of your positive or negative skills, or unhealthy or poor skills? So next slide. So as a psychologist, as a faculty, as a professor, we like to put models out there, and models sort of help us try to explain a little bit of what we're doing. Okay. On the left side, basic concepts. That's what I covered last month. That's the stress, the crisis, the unpredictable, the quality of life. How is that mediated by? Well, the middle, what kind of coping skills do you have? Okay. Are you drinking a lot because of it? Are you problem focusing? Are you emotion focused? What kind of mediating factor are you using to handle those basic concepts? And because of those, what are your results of your coping skills? Are they good quality of life? Are they living well? Are they depression or anxiety? This is what the model. I'm going to cover the middle and the right today. Okay. Next slide. The shock part, the anxiety, the now. So this is the results of this is the right part, the right side of that model. This is the result of my coping skills. So when I was injured, August 22nd, 1986, that's a long time ago, 33 years ago. That was my second birthday. And all of you who are disabled have a second birthday. You have that one day, one time, one incident that you can recall as your life has changed. And physically, you're a different person. I remember that Friday night on that August 22nd when the doctor gave me the information that, I wasn't going to walk again. I really didn't believe him. I did not think it was relevant to me. For some reason, my brain just could not accept the fact that he said I couldn't walk. I just said, yeah. In my head, I'm going to walk again a few months down the road anyway. So my coping skills did not allow me to accept the information, and I was in a shock mode. I'll give you another example of a denial. I'm going to talk a little bit more about anxiety and depression later, but a denial. There was a point that, and I remember seeing a note that said, someone wrote functional denial. That sometimes denial is good for you. Now, if you do it a long time, it's not good for you. I give the example of I get letters, bills, and I don't always get to them early. And I know why I don't get to them early. I feel like if I don't open them, I don't have the bill. Now, you know the bill's there. But for some reason, if you open them and actually looked at them, then the reality is that you have to pay for it and you own somebody's money. But if you don't open them, even though they're sitting on your desk, it's a way of denying the fact that the bill exists. And that allowed me to reduce my anxiety. And so it's functional. Now, if I don't pay the bill for the whole month, now that is not functional. Same thing with one time when I was a student of psychology. I was a grad student learning to be a therapist, and I had another spinal cord patient, and he was just newly injured. And in our sessions, I remember him saying to me, I can't wait to walk, and I'm going to be walking down the road. And he had all these aspirations to walk again, and he worked hard. And in the back of my mind, I kept wanting to say, no, you're probably not going to walk, or at least walk normally. And if you do walk, it's not going to be a functional walk. It's going to be a difficult walk. I wanted to give him insight. So I asked my supervisor, that I wanted to say these things, and is it appropriate to give this patient insight? And the supervisor said, absolutely not. Absolutely not. You need to allow this person to have hope, to have meaning right now, because of that, he's working hard in therapy. Because if you give him maybe insight at this point, it's going to be developed into a funk, and maybe he won't work hard in rehab and maximize his potential for as much recovery as much as possible. So at that point, denial was a good thing. Okay. Let's go to the next slide. So another consequence of poor coping would be anxiety. So anxiety sorts a category, and here are some symptoms in that category. It says feeling nervous, is irritable, on the edge. I like that, on the edge, because on the edge means sometimes I always think of on the edge of a cliff, always afraid to fall off, and you're always afraid that at any moment someone's going to push you over. So you're on the edge. You feel impending doom or the panic of being pushed. Some people have increased heart rates, breathing rapidly, like a panic attack. Others feel tired and weak all day. They just don't want to get out of bed. They feel irritable. Some people have difficulty sleeping, or they have nausea, diarrhea. So these are all these symptoms of anxiety. And these are symptoms that get worse as you are usually transitioning to new things, situation-specific anxiety. Now, some of you can have just generalized anxiety disorder, which is just excessive worrying all the time. You're just worrying about what you can't control in life, and then all the things that life has given you, and you just can't seem to feel like you have a good grasp of them. Now, in general, 16 to 28% of people in our population have anxiety. So it's fairly common. It's probably the most common mental illness. For spinal cord, because of our paralysis and our inability to control our lives even more, that percentage goes up as high as 40% to 60% in some articles. So it's definitely evident. Almost at least half the people with spinal cord injury have anxiety. And where do I have anxiety? Well, I have anxiety when I am having concerns about my caregivers. You know, if the weather is bad coming up, or we're going to have a snowstorm, or is the caregivers going to show up? Others have anxiety when they transition to a new job. I have this podcast. I didn't know what I was expected, how I was going to do it, how to perform. So that creates anxiety for me. Some of you may be going to college, trying to start a new career. That will create anxiety. And these symptoms may show up for you. Okay. So the critical part for you, that as you are starting anything new, going to college, having a new job, having a new career, these symptoms may elevate, exacerbate, and you need to make sure you go to see someone to determine, is it anxiety or is it something that's more medically related? And it's maybe not even part of anxiety, but sometimes it's hard to tell because of being a spinal cord injured. But the main ones that we talk about, the irritability, the heart rate, the impending doom and danger, difficulty sleeping, difficulty eating, those are very common. Okay. Knee slide. Okay. Another result of poor coping or unhealthy living would be depression. Depression affects about 8% of the American population. And for spinal cords, it's around a third, 33% I see in one study. Okay. For women, it's higher than in the males. Same thing, the general population tends to be higher in females. Females, spinal cords were up to about 50%. Okay. Some of the symptoms of depression. Now, let me go over some of the symptoms. Change of sleep, feeling down and hopelessness, change in appetite. Again, a little bit overlap with anxiety, difficulty concentrating, self-blame, worthlessness. Real severe depression, now we're talking about suicide. Okay. When you have these symptoms, now clinically, we tend to use 2 weeks. If you have these things more days than not in a 2-week time period, having about 5 out of 70 symptoms, then we technically could diagnose you as depressed. But again, some of these symptoms can be relevant to medicines, medical issues, as well as some other spinal cord related factors. So it's really important you go to someone who's familiar with individuals with spinal cord and have a good clinical assessment. 2 weeks. Now in the anxiety, well, at least for generalized anxiety disorder, they said about 6 months of having this uncomfortable pending doom. Okay. Now I put the National Suicide Prevention Hotline on there in case anyone have any questions about or have concerns about depression. and or thoughts of suicide. Suicide rate in the general population is about 2%. For individuals with spinal cord injury, it's about 5 times more. So it's about 10%. So it definitely ramps up with the injury. We know that the level of injury, depending on the article you talk about, some people, it doesn't matter if you're a quadriplegic or a paraplegic. But some articles indicate that paraplegics actually have a higher rates of suicide than quadriplegic. So, and one more important factor seems like the first 5 years is the hardest. If you can get through the first 5 years and you can get through without getting too depressed, it appears that after that, the suicide rate really goes down and life goes on and people seem to adjust to the injury. Okay, next slide. So how do we get there? How do we get there? How do we avoid going there? So I'm going to tell you right now on how you get there. And this is the middle part of that model. Okay, these are the negative stuff. Over the next 2 slides, I'm going to give you examples of how do you get there to the anxiety and depression and the unhealthy living. Well, it's called poor coping. It's having coping skills like denial, having too much denial, wishful thinking. In the beginning of my injury, I used to go to sleep and wish that this was a bad dream, and that every day when I wake up, the dream would go away and that I would be walking again. And that never happened. I had that wish every night for my first year, and that never changed. I'm not saying I shouldn't cope like that. I'm saying that after a while, I'm glad I stopped doing that and lived to realize that next day, be happy that you can wake up and engage in the world. So that's another negative. Self-blame, blaming others. I used to blame myself for having the injury. I used to wish that I'd listened and not got into that argument with my father before I went surfing. I wished that I was a better son. So I had this really concern about not being a good son and not a good person. And I blame myself for having this injury. And because of those, if I would have stayed into those negative coping strategies, I would have had more stress in my life, more sadness, and probably not willing to accept that I am a person with a disability, a physical disability. Hey, let's see how we're doing on time. Next slide. Oh, by the way, on substance abuse, that's another negative coping strategy. It's really critical that if you drink a lot or if you do illicit drugs, that needs to be controlled. No matter what anyone can teach you and how much insight you become to having good skills, that is overshadowed by drinking and drugs. So that needs to be controlled and addressed first before you can apply the other coping skill. What is that like? Another example would be smoking. And people can exercise and run, but as soon as you smoke, you just eradicated all the positive things that came from running and eating well and etc. So you need to stop the smoking and then exercise and diet. That's the benefits of all that. But smoking, drinking really overshadows everything. Another bullet of many things, poor coping skills, overeating, oversleeping, drugs and alcohol. I'm going to talk about sleeping. Sleeping, I used to love to sleep. Sleeping was such a godsend. When you sleep, you forget. When you sleep, you dream. When you dream about everything, all the good things, all the things that you could and wish you could do. And I used to love to sleep. I don't sleep as much as I used to. I wish I could sleep better at night, actually. But so sleeping is an okay skill, okay coping skill. But if you sleep too much, it's not a good coping. You need to sleep well because it's incredible energy if you sleep well. Venting to others. Now, if you vent to others and you vent to the right person, then that's good. If you repeatedly vent to the same person over and over again, then they get annoyed after a while. So in some ways, it could be a negative coping skill. Next slide. So here's the good parts. Here are the positive stuff. Here's the stuff that I really want you to so I want you to be able to identify if you're not using if you're using too many of the unhealthy coping skills. Now, when you look at yourself and you say, am I living healthy or am I living well? Am I living poorly? It's not that you have to do all positive coping skills. It's that most of your coping skills has to be positive. You're allowed to have a few of the negative ones because why? They're easier. They're immediate gratifications. But the positive ones take a little more energy, but you need to do more of them in order to live well. So here are a few of them on these four. Seeking information, going to the right doctors, asking the right people about what you need, going on to these forums, ask other people with spinal cord injury what they do to help out in their life. I myself was able to find an individual. I was looking at a forum and someone posted, how many years are you post-injury? And one individual posted that he was 79 and was in a wheelchair for 62 years. And his name was Duke Williams. And Duke, I hope you don't mind me shouting out your name, but I had a great opportunity to talk to Duke. And Duke was one of the first teachers ever certified. And again, I think it was a state of, I'm going to say Michigan in 1950s. And he became superintendent, he was athletic director, he was all these things. And he demonstrated to me in my conversation with him a lot of healthy coping skills. And I was really fortunate Duke allowed me to, I saw him, I am him, and he said, hey, can I give you a call? I'd love to touch base with you, how you manage your life, because you're 62 years post, I'm 33. And there's not a lot of people ahead of me that had more years, and I would love to know how you manage your life. And Duke was happy, he was willing to take my call. I talked to him a few times, and he did a lot of these problem solving, planning, social support. Another slide. I'm going to give you another slide next slide. He talked about engaging problem solvings and doing creative to-do lists. So he used a lot of these positive coping skills, and therefore thus he lived well. Now, don't get me wrong. Duke still had things that he struggled with. When I asked him, is there anything he regret or frustrated, he said, well, I put my parents through a lot when he got hurt at age 14, and he felt a sense of responsibility there. And I can tell he was really upset with that because he became emotional during our conversation. But in general, he had a really significant amount of good coping skills, which allowed him to live well until 79, 60 years, 2 years post. And one of the things, I hope, Duke, you don't mind me saying this, is that it was amazing that he even took my call. Duke is in hospice right now. And so, Duke, I'm thinking of you. Thanks for taking my call. And so we'll go to the next slide. So that last slide was problem-focused coping. That last slide was, if you want to change the situation, what active things can you do? In this slide is, if the situation cannot change, what coping skills can you change to adapt to the situation? So again, let me reiterate. The last slide, if you go back one for me there, Kaylee. Problem focus. This is saying, okay, I have a situation, I don't like it, I'm going to change it. So these are the good skills to use. These are the ones that you can, coping skills that you can try. Walk away or roll away. Time management, creating a to-do list. I do a to-do list. I do every day, I spend an hour dealing with my disability issues. Not life issues, disability issues. If it's ordering something, if it's calling a doctor, etc. That is my problem solving for. And I found out if I deal with it every day, it seems like I don't hit with too many major shock, trauma stuff if I'm managing it every day. Next slide. So this slide, emotion focus, is saying, look, the situation won't change. My disability will not change. My physical paralysis will not change. So how do I manage that? Well, here are some emotion-focused skills. Drinking a good cup of tea, doing yoga, drawing, listen to music, playing guitar, relaxation, exercise. So these are to take away the anxiety and give you something functional to do at the moment, the here and now. So you need to have a list of these things in your repertoire. You need to have a list of the previous things in the repertoire. And when you get into a funk, pull out your book and say, which one am I going to use? Okay. Next slide. So this is the slide that I'm going to try to pull everything together, is that when you have a disability, you're going to learn hopefully good, healthy coping skills. And then you get through that situation at that time in your life. Now, the stage model would say that, well, once you get through one stage, you get to the next stage. And I don't believe that is a good model for how individuals like us adjust to our life. If anything, ours is more like a pendulum. Okay, so you have a rough time, you learn how to adjust, and you go and swing into the good side, and you're healthy, you're living, and then life comes and you have another event or another issue, and then you get back on the left side and you're adjusting and you get more stress and more unpredictability, and then you use your coping skills and you swing to the right and you're living healthy, you're living well. You have a podcast that you have to do once a month and you swing back to the left because now you're dealing with the stress, the PowerPoint, your self-image, your self-concept, your unpredictability. And so you grab all your coping skills and you readjust and you try to make the podcast better, and you're getting better each one, you hope. And so it goes back and forth. Also, those who are nearly injured, I think those are the times when the greatest stress comes from, at least based on research, is that suicide seems to occur most often first 5 years. So if you can get through those first 5 years, Learn to live well, learn to adjust, learn to adapt. It gets better. Now, literature also shows that we tend to stay physically stable pretty well for the first 15 years. At least one study shows. And then after the 15 years, it seems like the body seems to give up a little bit on us because we're in a wheelchair for such a long time. So first 15, keep eating well, don't gain weight, get a good mindset. And then when the body starts to give up on you a little bit, hopefully your brain could be as strong and we move forward in our life. So newly injured versus lifelong injury. Now, this last part, when you're newly injured, but you're an older individual, and there's starting a big group of people who are geriatrics who are having spinal injuries at a later part in their life. That's a whole new ball wax, and there are issues such as understanding the physical deterioration of a normal age person versus spinal cord injury. I don't want to go into too much details about that, but that could be a whole nother podcast. So, okay, next slide. So this is the Q&A. So I am going to read a few questions that was sent in to me before the podcast, which I appreciate. And it helps me know how to or focus on what needs to be addressed during the podcast. So someone wrote, constant fear of something going wrong when doing any tasks in the kitchen. 40 plus year of hemiplegia, but ambulatory with brace. So my suggestion to you is that if you love being in the kitchen or you have to be in the kitchen, problem solve. See if there are things you can do to make your stability better. Having a high stool to sit on, having a different, maybe a walker to post on. So are there any other mechanical things that can reduce your anxiety? If not, and you have to do it, and you can't change your environment, and then my suggestion would be breaking that down into smaller increments and developing some emotion focus by taking deep breaths and trying to reduce your anxiety as you approach your next activity. How can you tell, question number 2, how can you tell people have anxiety or depression when they are hiding it? My answer to that is that if the person truly has anxiety and depression, they're not going to hide it too long. Their natural overt behaviors, their agitation, their sadness will come out eventually. And they can hold it for an hour, maybe. They can hold it for a few hours, or a few days, but over time, their natural self will come out. I don't think people truly can hide clinical depression or anxiety too long. Question number 3, I am an occupational therapist looking to broaden my skill set of helping my patients adjust and coping following their injury. My suggestion is that occupational PT, nursing, you are the front line of our ability to relate to people. It is because of you guys who make us feel like we're still human beings that we can move on in life. So my suggestion for any one of you in this profession is to truly treat us like we're everyday people. Truly treat us like you would treat any other person out there, with understanding, compassion, and sometimes a good stiff kick in the butt. The more you treat us as a human being, more we realize that, hey, maybe there's life out there because we can relate to others. So I would be less concerned about being a psychologist and more focused on being a human being with us. So, question number 4, if someone struggles with anxiety 24/7, what can they do to keep their minds from running all day long? Well, emotion focus is critical for this person. You know, if your brain's conscious or anxious, you need to be able to slow that down. So some distraction techniques, a good book, something that makes your brain go different. Meditation would be a perfect thing for you as well, because meditation forces you to force your brain to learn how to not being anxious. So behavioralist theory says that you cannot be anxious and relaxed at the same time. So if we teach you how to be relaxed, your brain will hopefully slow down and relax. Obviously, if it's something you can change, problem solve it, change the situation. Because if you're thinking about it too much, most of us who think too much are thinking about things we can't control. And that's going to elevate your anxiety. So if you can't control it, like for example, the weather, we all worry about the weather for some reason, but you realize you can't do a thing about it. You just adjust to it. If it rains, you use an umbrella. If it's too cold, you wear more clothing. So some things you can't control, so you got to let it go and go to something else. Last question, concerning not wanting to be alone due to tetraplegia. Well, that's sort of what we're going to talk about in the next podcast. We're going to talk about relationships, intimacy, and sexuality, and some of the intricacies that goes along with that. Okay, next slide. Kelly, you had some last questions for me?
Yep, we had 3 questions come in the Q&A box. The first one is, how can I help my boyfriend dealing with anxiety and depression from his head injury? Main thing is headaches that he deals with daily.
Okay. Well, the anxiety and depression that comes off of a head injury is very, very difficult, because one of the things for me as a psychologist, can we maximize your brain's capacity to cope? And when you have a head injury, that sometimes take that option out the door, because now your brain's not functioning like it used to do, and you can't maximize that potential. So one of the things I would focus on is changing the environment, reinforcing positive things. I would also make sure the caregivers are in a good, stable mindset, because your boyfriend is going to feed off of your anxiety and depression and your stress. I would also think that the headaches, obviously rule out medical issues, because what medication, what facets of his injuries may be causing these headaches, and try emotion focused coping skills like music and meditation, and see if he's able to handle those things. Those things would help with maybe calming the brain down a little bit. Okay.
The next question we received is, what is your opinion on regulated marijuana to treat pain, anxiety, and depression?
Now, I have not read a lot of studies out there about how medical marijuana can work, but what I do know is that from clinically, I hear a lot of people say that it is an incredible help for anxiety. It's an incredible help for pain. I apologize, the phone's ringing. And so my suggestion is talk to your doctors about it. And if they feel that it's something you are comfortable with and you're willing to try, give it a shot. It seems like anecdotally from clinically, a lot of people have some major positive results from it. When I posted something on a forum asking, do people getting depressed after their injury, and if they didn't, how do they manage to avoid it? Several times people posted that they use medical marijuana or marijuana to manage the stress and the pain. So it must work for some people. Okay.
And then the final question we received is, sometimes I get the feeling that I can't go talk to someone. Even though I'm surrounded by people who love me, I'm not a very talkative person. How do I help myself?
That's a great question. Not everybody wants to do talk therapy or comfortable with talk therapy. So my thoughts were, I hope you try different therapists. I try to go seek professional. I'm not biased, obviously, but talk, because if you get the right person, you will be able to connect with them at a different level than the people around you. And because of that trust and comfort, you will end up probably speaking a little bit more than usual. So my suggestion is give therapy a shot, talk to different counselors, and hopefully that will help you communicate your concerns and not have to rely on your loved ones to be your main support. Okay. Is that it? Questions?
Yep, that was all the questions that came in today.
Okay. Can I get the last slot? Closing thoughts. So I want to tell you that, as you can tell, I try to use humor both in my presentation as well as in my stories. I think humor is probably one of the best coping. I didn't write that in the healthy living, but to live well. But I do think being funny and being able to laugh at yourself is a great way to get through life in general. So I'm going to try to give you as much humor and interest in my podcast as often as possible. I also would like to ask you to make sure you do the survey at the end to just make sure I'm going in the right direction. Give me some suggestions on what topics, also some ideas of how well I'm doing. I also hope that you let others know, caregivers, therapists, counselors, that we are about this podcast, because the goal for us is to inform you. And this podcast would not be relevant if we don't get it to the people that needs it. So two things: survey, give us some suggestions, and get this podcast out to people. So thank you. So I have to leave you with a closing thought story. So my story, because next month is about relationships, I wanted to tell you about a story of mine. I believe it was with my girlfriend. I don't know if she was a fiance at that time, but I was definitely someone I was dating at the time. And we were going up to University of Connecticut on Route 84, going through a town called Dansbury. And up in Dansbury, on our way up that one day, I remember there was a McDonald's. She wanted to get some coffee. It was a nice warm day, and I said, "No, it's great." So she went in to get coffee while I sat outside. I got out of the van. I wanted to get some sun. Now, while I was waiting for her, I had to drain my bag, and I had an electric leg bag drainer. I'm not sure if you know what that is, but I have a leg bag that it's hooked onto my condom catheter, and every day I have to drain that, and I would traditionally drain it in the grass. But if I don't like you, I probably drained it on your floor while I was in your house. But anyway, I wanted to drain this, and I was sitting there in the driveway, in the parking lot. I thought, you know what? Maybe I'll draw a heart with my urine while I'm draining this, and try to impress my girlfriend when she comes out. So I did that with my chair and my electric leg bag drainer, and then of course she came out and saw it. So my question for you was, do you think she was impressed? So thank you. I will see you next month in November on our next podcast. Live well. This is Dr. John.